to the cough syrup tragedy. After the deaths of several children in Madhya Pradesh and Rajasthan linked to a cough syrup, the Maharashtra Food and Drug Administration has taken a major step. The FDA has in fact launched a statewide inspection drive against medical shops selling cough syrups and other classified medicines without a doctor's prescription. During the very inspection, what's been found, let us take you through the details briefly. 88 drug retailers were ordered to immediately stop selling medicines. 107 retailers were issued show cause notices asking why their licenses should not be suspended or cancelled. Now, earlier, the FDA had also banned the sale of cold trip syrup in Maharashtra and appealed to the public to report any stock of cold trip syrup with the batch number 13 to the authorities. So these are the latest details that we are bringing to you, and right now we also have Omkar joining us on the broadcast to bring us more details on this very story. Omkar Wable. Omkar, a very good morning to you. Let us understand what exactly came to light from this very inspection drive in Maharashtra post the cough syrup tragedy that's marred both Madhya Pradesh and Rajasthan at this point.
Well, exactly. This is an important step and an initiative taken by this Food and Drug Administration Department of Pune, and also some surveillance is going in Maharashtra, which is especially linked to the death of children in Madhya Pradesh and some neighboring states. So, at least now, action is initiated against 20 pharmaceuticals, and there are also different companies on which surveillance is still going on. So now, FDA is taking action against all these pharmaceuticals, and plus, pharmaceuticals were giving cough syrups and some medicines without the prescription of the doctor. So now it is very clear that there are 22 pharmaceuticals in the Pune region and a neighboring part of the Pune. The action has already been initiated and already action taken.
Right, Omkar, thank you for bringing us all those updates into this very breaking input that we were bringing to you viewers. In fact, as we speak of the cough syrup tragedy, let's take you through the details of what exactly went down. It's a tragedy that's shaken the nation, let us tell you. The main accused in the cough syrup tragedy that killed over 20 children has now been nabbed. But even as the probe continues, political blame game at the same time in fact escalates as well. Tracked down to a relative's house after days on run, police says he was planning to flee abroad. Post-mortem reports are in and investigators say more arrests are likely to take place. But even as this probe widens, the political blame game has only been intensifying. Madhya Pradesh Chief Minister Mohan Yadav has alleged non-cooperation from the Tamil Nadu government, accusing the DMK of delaying key inputs in the investigation. The AIADMK too has hit out, calling it a regulatory failure by the DMK government, saying unchecked manufacture of spurious cold syrup led to the death of 20 innocent children. Tamil Nadu BJP's Annamalai has called it a shameful incident for Tamil Nadu's pharma sector, claiming over 364 violations were ignored as the company continued to operate. But the Tamil Nadu government has, let us tell you, rejected all charges at this point, saying a ban was already issued immediately after contamination was found and that the centre and Madhya Pradesh initially claimed the medicine was safe. Health Minister M.A. Subramanian insists Tamil Nadu acted fast, while others are now playing politics.
कि मैन्युफैक्चरिंग यूनिट से ही गलती हुई है कि वहाँ से जब दवाई बाज़ार में आने से पहले उनको गुणवत्ता चेक करनी चाहिए थी उसकी, उसमें कहीं ना कहीं चूक हुई है। तो तमिलनाडु सरकार ने जिसने उसको लाइसेंस दिया था मैन्युफैक्चर का, उनकी जवाबदारी थी कि कोई भी बैच यदि बाज़ार में वितरण के लिए जा रहा है उसकी गुणवत्ता जाँच कर ली जानी चाहिए, जो कि नियमानुसार अनिवार्य है। तो कहीं ना कहीं उसकी चूक तमिलनाडु सरकार के द्वारा भी हुई है।
जो रंगनाथन है उनकी गिरफ्तारी एसआईटी जो कि छिंदवाड़ा से इस कार्य हेतु गई थी, तो उसने जो है बड़ी मशक्क़त के बाद वहाँ पे उनको जो है अरेस्ट किया है और अरेस्ट करने के बाद उनको विधिवत मेडिकल करा करके अभी ट्रांजिट रिमांड लेने की प्रक्रिया अभी जारी है। तो जैसे जैसे तथ्य सामने आते जाएंगे, अगर डॉक्टर्स हैं तो डॉक्टर, वेंडर है तो वेंडर, और होलसेलर है या रिटेलर है तो उसका क्या रोल है इस पूरे घटनाक्रम में, उसके अनुसार जो कार्रवाई इसके खिलाफ में की जाएगी। मेन अक्यूज नहीं है, वन ऑफ द अक्यूज हैं, वो 2 लोग तो ही हैं, इसके अलावा और भी बढ़ सकते हैं।
A company like this based out of Kanchipuram, now it is coming to light more than 364 violations were found at different points of time. Still this company was allowed to function. Still this company was allowed to export medicines to different parts of our country. Tragically in Madhya Pradesh, lot of children have died. In Rajasthan, lot of children have died. I personally believe the Tamil Nadu government should take responsibility because this company was functioning right under our eyes, and CM should make a statement, review the whole process and make sure all the companies functioning like that, they go through a process quality audit in the next 15 days.
Now, as we speak of this very tragedy, viewers, let's take you through what exactly is a safety checklist. What are the criteria that must be checked for a cough syrup to be declared safe? The manufacturer's details need to be there. Name, address and batch number must be printed to avoid obscure or unverified brands. Also, search if unsure. So this is number 1, which must be tick marked. Manufacturing and expiry dates, those are very important. Both dates must be clearly mentioned and valid. Reject syrups with smudged or missing dates. Remember, this is something we are bringing to your particular notice as well as to how you should be looking out at these very details on the very medicine that you are consuming, the syrup that you're consuming. Should not have cheap industrial chemicals in it. How will you get to know this? Diethylene glycol and ethylene glycol, these are 2 ingredients which are toxins, which is what you should keep an eye out for in syrups. Again, the drug license number, the medicine must be carrying the license number that's been issued by the state drug authority. No license, remember, means no accountability. So that is something which is to be noted very significantly as well. Also, the WHO and GMP or the ISO certification that is there on the medicine, even that needs to be looked at. Prefer syrups with the WHO, GMP or the ISO marks. Beware of fake or lookalike logos being printed on syrups as well. So you should take a note of how these logos look so that you can look at the syrup and see whether these have the certification. Again, age and dosage instructions to be followed strictly. Look for age-specific directions or dosage. Avoid syrups that claim safe for all ages. Number 7 is the storage instruction. That also must be in fact looked at. If you've bought the medicine, how should you store it? What conditions must be specified, like store below 25 degrees Celsius or protect from light or poor storage. Also, labeling indicates the low quality control in such medicines. So be very careful with that very aspect. Source of purchase, there should be a verified source of purchase. Buy only from registered pharmacies. Avoid unlabeled, opened or refilled bottles. Keep a note of these very indicators, whether it was opened or the bottle seems to be tampered with. Again, the QR code or barcode, all these medicine syrups have it on their labels itself. Many reliable brands include these codes linked to the authenticity or test reports in the very code, which does not work. If you see that the QR code that's been mentioned does not work, do not use that product. Again, report anything suspicious that you find on the label or even with regards to the very medicine that you're consuming to the nearest drug control office. Use the CDSCO website under the suspected adverse drug reactions. These are some of the important points that you should be noting when you are purchasing cough syrups, and make sure they are checklisted when you are purchasing these medicines. Milan Sharma joins me on the broadcast with more details on this. Milan, a very good morning to you. Let us understand where the entire probe stands at, the investigation stands at in this entire tragedy at this given point. There have been allegations that the Tamil Nadu government is not, in fact, cooperating. What are we looking at in terms of facts?
Well, at the moment, it looks like the investigation is moving forward because certainly there have been arrests that have been made in this matter. When we look at the owner of Sreeshan Pharmaceuticals, he has been booked for criminal negligence, and many state drug controller authority personnel have also been suspended on the negligence that has led to the deaths of now 21 children in Madhya Pradesh. And on the CDSCO side, the Central Drugs Controller has said that they are going to go around on a nationwide crackdown on cough syrups, and especially that's going to make sure that all these points that you just raised behind the label packaging, warnings, working of QR codes, the suppliers of raw materials, the kind of facilities in the manufacturing units, everything is going to be checked for each and every cough syrup manufacturer. So, one said, one spoiled apple in a basket ends up spoiling all other apples. And this crackdown is going to show no mercy to manufacturers, even if there is a slightly higher DEG or EG, as has happened in terms of two more cough syrup manufacturers from Gujarat, Recipe Fresh and Relight, where the DEG levels were slightly higher by about 1 or more percent. But at least for cold drift, the kind of the DEG that was there in that is about 46% to 48%. That is extremely poisonous for the children who were consuming it. And now the CDSCO also expects that something that happened with Tamil Nadu FDA should not be repeated, and all states should be on the same page with the center.
Right, Milan, thank you for bringing us all those details with regards to the probe that's currently underway. Viewers, that's all the updates that we have for you on this very story. We are keeping a very close track of how things are developing.